Welcome to the Cerner Community Behavioral Health Training Series. In this session, we will have an introduction to the EMR and learn about some of its features. Learning objectives. By the end of this training, students will be able to demonstrate how to log into the EMR, explain information derived from staff and client panels, explain information derived from home and client tabs, and demonstrate how to open a client. An electronic medical record, also known as EMR, is a digital version of a consumer's medical record to allow for the consumer's diagnosis and treatment. Examples include Allscripts, Cerner, eClinicalWorks, and Epic. For CHCS, you will document into Cerner Community Behavioral Health, also known as Anasazi. EMRs are beneficial in that they promote complete and accurate information within the medical record to allow for the best possible care. It prevents illegible writing, ensures required fields are completed prior to finalization, and that the service credentials and signature are easily on display. EMRs also allow better access to information between hospitals and outpatient facilities for auditing and treatment purposes. And lastly, patient empowerment. It empowers the patient to be more involved in their health care for themselves and their families. Additionally, in regards to that information about what their treatment and care is, they can also get electronic copies of their medical visits, schedule appointments, and contact their providers via the patient portal. Anasazi is named after the Anasazi tribe, who are the ancestors of the modern Pueblo Indians. It was developed in 1989 as a comprehensive billing system for Texas community mental health centers. In 2012, Anasazi was acquired by the Cerner Corporation, and thus renamed Cerner Community Behavioral Health. Anasazi is a very comprehensive EMR, which consists of assessments, assignments, progress notes, treatment planning, managed care, cost accounting, e-prescribing, and scheduling. When using the EMR, you have access to patient information. As such, you cannot locate your own chart or the chart of others you may know. If there's anyone who's in the EMR that you may know, you have to contact Help Desk to ensure our privacy officer can sequester the chart away from you. No one must falsify, delete, or inappropriately alter documentation in the clinical record. Printing is prohibited if accessed remotely. If the EMR is inaccessible, contact Help Desk immediately so they can determine why. If the EMR is down, make sure to document your service either in your CHCS email or on paper until the EMR is available. All services or events provided to a consumer must be documented in the clinical record, otherwise it was never performed. All documentation must be completed prior to separation from employment or one's contractual obligation to CHCS. Only approved CHCS forms and formats are allowed to be used to document services. No entries will be made in advance in anticipation of rendered services. All handwritten and electronic entries and documents will be recorded, finalized, and signed at the time of service or shortly thereafter, but no later than 23 hours from service delivery. Entries completed 24 or more hours after service delivery will be considered delinquent or late entries. All consumer documentation must be documented in the appropriate consumer chart. It must be collaborative and entered into the EMR as you interact with the consumer. It must be written in the EMR and not on any other electronic sources to ensure consumer confidentiality. Any paper documentation should be limited to those that are not found within the EMR. It should be individualized, concise, complete, noting who, what, when, why, where, and how, appropriate, and pertain to the consumer. It must stand alone and justify what services were rendered as medically or clinically necessary. The use of cut, copy, and paste is prohibited in the medical record. This is defined as the use of computer commands generated through the use of the keyboard or the mouse that copies a selected amount of information with the intent to transfer the information through the paste function into another document or to duplicate the material. During the copy and cut functions, selected information is placed on a computer-generated clipboard. During the paste function, the selected information is taken from the computer-generated clipboard to be transferred electronically. If an error is made in the clinical record, corrections must be made within 24 to 48 hours of service delivery and made by the original author in such a way that original documentation can be viewed and audited with the signature and date of service. No entry or document will be corrected after the original author of the entry or document is no longer employed or contracted with CHCS. All corrections must be submitted to Help Desk via CHCS email only. Prior to submission, enter in the corrected documentation. Make sure to include the following with your submission. Copy your supervisor on all requests. Specific details related to the request, such as the error message, details, why the request is being submitted, what is the causing issue, etc. Initials and case number of case. Date of document, the erroneous document and the one that is corrected. Encounter ID for progress notes and type of document, assessment, or progress note. Security. It is critical to business functions and security that you lock or log off of unattended workstations, even if you are leaving for just a minute. You can do this by either pressing Ctrl-Alt-Delete and select Lock Workstation, or press the Windows key and the letter L. Always protect your password and security of your computer. Never share your password with anyone, not even your supervisor, or log in for someone else. When possible, properly place your monitor out of view of visitors. Maintain confidentiality at all times. Your password must be at least 8 characters long. It must contain at least one character from each of the following: an uppercase letter, a lowercase letter, a number, a special character. Passwords are case sensitive. Do not use any spaces. Expires every 90 days. You'll be prompted to change when it expires. Passwords must not be shared with anyone. All the information you're learning about Anasazi can be found on our training website. You can locate this on Cerner.net by going to the right side under Quick Links and finding Cerner/Anasazi Training. This provides all steps on how to use the EMR. Please utilize as a resource prior to contacting Help Desk. Now we'll learn about the different parts of Anasazi. These include login, initial view, the application menu, how to open a client, the panels and tabs, scheduler, doctor's homepage, and reports. To log into Anasazi, for all staff except prescribers, you will utilize the Live Anasazi Central icon on your desktop. For prescribers, you will utilize the doctor's homepage icon on your desktop. Double left-click on this icon to open up the EMR. The icon may look different, however the label below the icon should read the appropriate label. Next, you'll receive a logon window, as you can see to your right. Within the password area, you will type in the same password as when you logged into the computer. This is also known as your network password. Afterwards, you will left-click once on OK to go to the next portion. Next, you may get notifications and warnings on security certificates. Make sure to left-click once on Don't Ask Me Again for remote connections from this publisher, as shown in the red box in the image to the right. After selecting this, then left-click once on Yes, as shown in the green box in the image to the right. If this window appears again, please complete the same steps specified above to resolve. Next, a window will appear showing that you are connecting to the remote application. Once this window resolves, it will take you into the Anasazi login screen. Next, a Cerner Community Behavioral Health window will appear. Enter your staff ID number under Staff ID and Cerner Community Behavioral Health password where the red box. If the password is forgotten, please use the Forgot Password function, yellow box. If this is not set up or does not work, contact Help Desk to reset. Login access is provided after online EMR training and classroom practical test. After login, the application will open. The window will list your name and, if applicable, any credentials you have. If credentials are missing, please contact Help Desk for assistance. In the upper left-hand corner of your screen, you will see the Kokopelli icon. Options available within this item are Application Menu, Security, and About CCBH. The application menu provides all the reports and other modules available in Anasazi that are available within other windows. Other modules include Doctor's Homepage, Client Assignments Maintenance, Client Abstract, the Reports, Client Services Listing, Client Services Report, Third-Party Billing Suspense Report, and Scheduler. These modules and windows can either be opened via the menu or by adding the items to shortcuts. To open the application menu, you will first left-click once on the Kokopelli icon, then left-click once on Menu, and here you will see a list of available items to view. If additional items are required in the menu for your job, please have your supervisor contact Help Desk with the appropriate access request form. Under the Kokopelli icon, we also have the Security and About CCBH items. Security, we have Lock, which you left-click once on to lock your Anasazi session. However, by locking your computer, as we talked about in a previous slide, you do not need to also lock your Anasazi session, because it will already prevent access to Anasazi by locking your computer. Change password. This allows you to change your password within Anasazi. And manage security questions. This allows you to create security questions if upon login you cannot remember your password and need to reset. Please ensure setup as soon as you first log into Anasazi. About CCBH, you left-click once to see what promotion level and last promotion update of the EMR. The area that lists your name and the items below that is called your staff panel. This lists information pertinent to you in your utilization of the EMR. It consists of the caseload, scheduled services, notifications, shortcuts, and capacity management. The caseload tab shows any clients assigned to you, such as if you're a care manager. For a client to appear on the caseload, you must be listed as the server on that consumer's assignment. To add clients to this tab, either add or edit the client assignment to update the server. The Scheduled Services tab lists any upcoming scheduled appointments. Appointments must be scheduled through the Anasazi Schedule module to appear. To gain access to the Scheduler module, please have your supervisor contact Help Desk for this access and training to be set up. To open the Scheduled Services tab, left-click once on the second tab from the left, as shown by the orange box. Schedule can be viewed by day, week, work week or full week, or month, as shown by the green box. To view the other months, left-click once on the calendar on the left, as shown in the blue box in the image to the right. On the schedule, you can double left-click on the client to open the client chart, as shown by the pink box in the image to the right. The Notifications tab lists non-final approved documentation, documentation pending signature, pre-approved medications pending final approval, client action notifications, including target date pending or pass, and client action pending, client check-in for those appointments scheduled through the Anasazi Scheduler module, transmission of prescription error, and refill request pending. Notifications are either for anything pending by the staff or for any clients that appear on that staff's caseload. If the latter exists, there could be items generated by another staff because the client is on your caseload. Therefore, please use the IT notifications emails and the data warehouse to determine any non-final approved documentation. Use the Notifications tab for other types of notifications. To open the Notifications tab, left-click once on the third tab from the left, as shown by the orange box in the image to the right. To filter notifications, use Search Notifications, shown by the blue box in the image to the right. Type in the phrase to filter by, then select Enter on your keyboard to filter the list of notifications. The Shortcuts tab lists items in other modules in Anasazi that you can open directly without having to search under the Applications menu. To open the tab, left-click once on the fourth tab from the left, as shown by the purple box in the image to the right. Steps on how to add shortcuts are located on the Anasazi training website on Cerner.net. The Home tab is located in the top left-hand corner nearby the Kokopelli icon. You will left-click once on Home, shown by the orange box, to open this tab so you can review. The staff search capability is only for staff with this access. Access is limited to supervisors and to nursing staff. Nursing staff use this functionality only within doctor's homepage so they can preview the provider's schedule. The refresh option is helpful to see the most up-to-date information. Items can change in other parts of the Cerner Community Behavioral Health application. Therefore, by refreshing, you ensure the information viewed is up-to-date and accurate. There are two refresh options. Within the Home tab, you have the Refresh Staff Panel button. Left-click once to refresh all of the tabs within the staff panel. If you only want to refresh one particular tab, Right-click once on the tab and then choose Refresh Paying Content. On the Home tab, there is the Add Client feature, which allows staff to add new consumers to Anasazi. Access is provided through the Help Desk. If required, please have your supervisor contact Help Desk to enable this functionality for you. The next three buttons allow you to update your Anasazi layout. The first, Restore Panel Layout, allows you, if your layout changes, to return it to the original layout design. Save Panel Layout allows you to make a change to your layout and then save it to those changes. Restore Panel Layout / Filters from Template allow you to undo a save change, and this will allow you to change your template to the original format. There are two ways to open a client. The first is via the case number, sort name, or SSN. Within the box, as shown in the green box to the image to the right, you would type in either the case number, sort name, or social security number, and then after finishing typing, hit enter on your keyboard to open up that consumer. Client Search is located on the left side with the red arrow. You would left click on this button to open up the Client Search window. When the Client Search windows open, you have the ability to search for a client either by their name, case number, date of birth, social security number, any one of those columns that you see there. To search, you will left click once on any of the data elements found within the column you wish to search by, such as the red box is name and the blue box is case number in the image to the right. Then you will type into the keyboard what you are trying to search for. This will bring up a search box as shown to the orange box in the image to the right. Finish typing in what you're searching for, then left click once on OK. When searching, remember to verify the social security number and date of birth. Once the client is found, you can double left click on the client or left click once on the select button shown by the pink box at the top to open. After the client is opened, the Client Panel and tab will appear. The Client Panel contains all saved and final approved information pertaining to the client. Example, the client chart. The Client tab is where any new documentation can be started. The Client Panel consists of the following tabs: Client Overview, Primary Assignment Assignments, Insurance Coverages, Authorizations, Scheduled Services, Services, Progress Notes, Current Treatment Plan / Treatment Plans, Assessments, Diagnoses, Medical Conditions, Medications, Client Photo, Client Attachments, Continuity of Care Documents, and Face Sheet. Client Overview consists of the client's name, date of birth, home and work phone, episode of care, primary assignment, SAI, known as Single Authorizing or Accountable Individual, which is the server located on the primary assignment, emergency contact, and pharmacy of choice. To open, left-click once on the first tab from the left, shown in the image in the right as the purple box. The Assignments tab lists all the assignments the client has been open to at CHCS. It's a useful tool to know the start and end dates of services at a particular unit. To open, left-click once on the Primary Assignment / Assignments tab, shown as the red box in the image to the right, which is the second tab from the left. If the tab is described as Primary Assignment, right-click once on the tab and choose Expanded Mode to see all of the client's assignments. Insurance Coverages tab lists all the insurances the client has been assigned to with billing priority noted. To open, left-click once on the third tab from the left, which is the blue box shown in the image to the right, or it could be a separate pane that's open to the far right of your window. The Authorizations tab lists the authorizations from the client's insurance along with authorization time period, pay source, and benefit plan. To open, left-click once on the fourth tab from the left, as shown by the green box in the image to the right. The Client Schedule Service tab lists all upcoming appointments for the client scheduled through the Anasazi Scheduler module. To open, left-click once on the Scheduled Services tab, shown as the dark red box in the image to the right. The Services tab lists all client services. It is useful to determine no-show appointments, any ghost or duplicate services, differentiating group or individual services, differentiating services without or with an associated progress note. To open, left-click once on the Services tab, shown as the blue-gray box in the image to the right. The Progress Notes tab lists all progress notes completed for the client. Progress notes are details of a consumer's clinical status or achievements. In some instances, the progress note is completed only for billing purposes as the consumer's clinical status is recorded within an assessment. All progress notes include the service information in the format of a service encounter. To open, left-click once on the Progress Notes tab, shown as the lavender box in the image to the right. To open a progress note, either double left-click on the item or right-click on the item and left-click on Progress Note Maintenance, shown as the gold box, to open. This will open the progress note to review. Progress notes have up to 3 tabs. The first is Clinical, shown as the orange box in the image to the right. Clinical tab consists of current client information, which is blue at the top, which consists of the case number, gender, date of birth, age, allergies, and if present, the client photo. Next is the overview and client narratives. Here you will find either the free text or template narrative that's provided for the consumer at time of the encounter. Double left-click on the narrative line, shown as the green box, to review the narrative that's found within the pink box. Below the current client information and client narratives, we then find the related treatment plan, which is the purple box. Here you will see the interim service log, recovery plan, or treatment plan that is attached to the progress note. Then below that, if present, any related clinical documentation such as assessments, medications, medical conditions review that are attached to the progress note will then appear. After the Clinical tab, we next have the Encounters tab, which is shown by the orange box in the image to the right. This tab shows the service encounter that is associated with the progress note. This is found in individual, multi-service, and specialized notes, but not in informational notes. For additional service detail, double left-click on the encounter, shown by the purple box, for more information such as who provided the service provided, time, unit, subunit, and how the service was provided. The last tab of your progress note is the Signature tab, shown by the orange box in the image to the right. Signatures associated with the progress note are located on this tab. If the signatures do not appear, left-click once on Pending Signatures, shown by the red box to the right, to view those signatures. Signatures appear in the box, as shown by the blue box. If a gold padlock is next to the signature, then it was gathered when the progress note was finally approved. To close the progress note, left-click once on Close Panel, shown by the green box in the image to the right. The Current Treatment Plan/Treatment Plans tab lists all treatment plans and interim service logs completed for the client. To open, left-click once on the tab, as shown by the dark blue box in the image to the right. To see all the treatment plans for the client, right-click once on the tab and then left-click on Expanded Mode. To open a treatment plan, either double left-click on the item to open, or right-click and then left-click on Treatment Plan Maintenance, as shown by the gold box. After opening the plan, left-click once on Close Panel to close the plan. The Assessments tab lists all saved and final approved assessments for the client. Assessments are a documented process used to evaluate, diagnose, and treat consumers to improve health and productivity. To open, left-click once on the Assessments tab, shown by the dark teal box in the image to the right. To open an assessment, either double left-click on the item to open, or right-click and then left-click on Assessment Maintenance, as shown in the gold box. The Diagnoses tab lists the current DSM-5 and ICD-10 diagnoses. To open, left-click once on the Diagnoses tab, as shown by the red box. The gold padlock signifies the information comes from a final approved assessment. The date of the assessment is provided with the example of January 5th, 2016. The Medical Conditions tab lists all the vital signs, medical conditions, and allergies inputted into the Medical Conditions Review window. To open, left-click once on the Medical Conditions tab, as shown as the green box to the right. To open an item, either double left-click or right-click on the item and then left-click once on Medical Conditions Review Detail. The Medications tab lists all medications that have been either prescribed or entered for the client within the EMR. To open, left-click once on Medications tab, as shown by the pink box. To open an item, either double left click or right click on the item and then left click once on Medications Maintenance. The Client Photo tab shows the most current photo of the client. Access to add a photo is provided through Help Desk. If required, please have your supervisor contact Help Desk to enable this functionality. To open, left-click once on the Client Photo tab, as shown as the blue box in the image to the right. The Client Attachments tab lists any paper documentation or imaging imported or scanned into Anasazi. The client attachment is added through steps listed under the How to Add a Client Attachment documentation. This is located on our training website. Access to add a client attachment is provided through Help Desk. If required, please have your supervisor contact Help Desk to enable this functionality. To open the Client Attachments tab, left-click once on the tab as shown as the brown box in the image to the right. To open an item, either double left-click on the item or right-click on it and then left-click once on Attachment Maintenance. The Continuity of Care Documents tab lists all clinical summaries generated within Anasazi. Access to add a clinical summary is provided through the Help Desk. If required, please have your supervisor contact Help Desk to enable this functionality. To open, left-click once on the Continuity of Care Documents tab, as shown as the lavender box. To open an item, either double left-click or right-click on the item and then left-click once on Display Document. The Client tab allows you to complete tasks that pertain to the consumer and will be part of his or her chart. The tab is available after a consumer is opened in Anasazi. To view, after a client's open, in the top left-hand corner next to the Home tab, left-click once on Client, as shown by the orange box. This will open the tab for review. Under Client Information, the following functions are found. Export Clinical Summary, shown as the orange box. Exporting the clinical summary based on the service visit. Access to this is provided through the Help Desk. If required, please have your supervisor contact Help Desk to enable this functionality. Display growth charts, shown as the blue box, used for consumers aged 2 to 20 years old to show their growth rates. And display HIPAA privacy documents, as the purple box. The next three items are to create new documentation in the EMR. The first is New Progress Note. This is used to create a new progress note for unscheduled appointments only. Scheduled appointments have progress notes created through scheduled services. New Assessment is used to create a new assessment that is permitted to be a standalone assessment without an associated progress note. New Treatment Plans and Interim Service Log is the addition of any blank treatment plan, recovery plan, or interim service log to the client chart. Recovery plan revisions and reviews are created through the existing current recovery plan. The next three items are functionality for medical services. New pre-existing medications is the addition of pre-existing medications to the client chart. New medical conditions review allows the addition of vital signs, medical conditions, and allergies to the client chart. Information entered here allows clinical decision support functionality for prescriptions and to submit controlled substances. Pharmacy of choice allows the addition of the consumer's preferred pharmacies to the client chart. Next, we have the broadcast alert, which is shown as the yellow box in the image to the right. It allows the creation of an alert in the consumer's chart. It stays available for 30 days after being added. Whoever creates the alert cannot see it. Acknowledging the alert removes it from the chart. So do not acknowledge unless you are needing to resolve it. DSM-5, it provides a copy of the DSM-5 manual for review. Close the client panel, closes the client so you can open another client to review. It is not required to do this to open another client chart. The Refresh Client Panel button works just like the Refresh Staff Panel button, except this will allow all the tabs within the client panel to be refreshed. So just like your Refresh Staff Panel, you will either click on the Refresh Client Panel button to refresh all the tabs, or if you want to refresh only a particular tab, you will right-click on that tab and then choose Refresh Paying Content. Scheduler is a module within the EMR that allows for the entry of scheduled events. All scheduled appointments within the Anasazi and Cerner Power Chart EMRs must be created within the Scheduler view. This facilitates and streamlines scheduling events for staff such as appointments, services, and tasks. To view Scheduler, if you are within clinician's or doctor's homepage, you will first left-click on the Kokopelli icon, then go to Menu, Scheduler, and select Scheduler Maintenance Multi-Day. If you are within the background of Anasazi, which will be a gray view, look across the top at the options and left-click once on Scheduler. Then, from the list, left-click once on Scheduler Maintenance Multi-Day. Doctor's homepage is used by prescribers and ancillary staff to permit prescriptions, and for ancillary staff to review a chosen prescriber's schedule and caseload. Access to Doctor's homepage is provided through the Help Desk. If required, please have your supervisor contact Help Desk to enable this functionality. To view, go to the Kokopelli icon, choose Menu, Assessment System, and left-click once on Doctor's homepage. Within the Anasazi EMR and the data warehouse, we have reports available that allow the extraction of medical, clinical, and reimbursement data to allow and facilitate our business needs. This data can be used to improve patient care and patient health, improve quality of care and clinical decision-making, improve staff productivity, reduce costs and increase good organization policies, track trends in data over time, share information with other providers and healthcare organizations, and provide efficient coding and billing. To view an Anasazi, there are two options. Within the Anasazi background gray view, you would choose the appropriate menu, which says Reports, and then find your report within there. Within Clinicians or Doctor's homepage, you will left-click on the Kokopelli icon, then go to Menu, then Reports. Within the list, find the appropriate report and then left-click once on it to open. In conclusion, an electronic medical record is a digital version of a paper chart that contains a patient's medical history. All services or events provided to a consumer should be documented in the EMR. Copy and paste is not allowed in the EMR. Additional EMR information can be found on our training website. For access to the EMR or any functionality found within, please contact us at Help Desk for assistance. For any issues, you can contact Help Desk at 210-261-1170 or at helpdesk@chcsbc.org.